Good morning, everyone. My name is Sarah Child, and I am with the Seattle Metropolitan Chamber of Commerce and with the Business Health Trust that the Chamber sponsors to offer health insurance to the members. Thank you guys all for joining us this morning for this We Got This WA series. This series is designed to bring experts directly to people in a time that we very much need to hear truth. We need to hear the facts and hear from experts as we navigate this new normal and this unprecedented time. I'm very excited to have Dr. Duchin today with us with King County to be able to talk about the decision to move to phase 2 and all of the impacts and thoughts that go into it. Thank you very much for our event partner, which is Business Health Trust. We are so thrilled that we're able to partner with the Chamber on these programs, like I said, just to bring information and experts to people. A few webinar logistics before we get started. If you need technical help, please use the chat box. If you have a question for the speakers, please use the Q&A, question and answer box. We will do our best to get to as many questions either through that chat or through that Q&A button, or answer things live throughout the program. And before I invite Dr. Duchin to turn on his video, I'm very excited to announce a new special thing that the Chamber and the counties have been able to do, or the county has been able to do together in partnership to bring businesses with supplies in order to start safely. So please take a look at the chat box. I just sent safestartkingcounty.com. We're going to be able to offer across King County in partnership with many other chambers, including Southside Seattle Chamber and One Redmond, who have really been leading this effort with us, cloth masks, disposable masks, and hand sanitizer. So you can go to this website and sign up, and distribution will be starting July 1st, so next Wednesday, so that businesses can continue to open and keep their employees healthy and safe. This webinar will be recorded. You can find a recording of that on the Seattle Metropolitan Chamber of Commerce website. And with that, I wanted to welcome Dr. Duchin, and I will turn it over to you.
Well, thank you, and good morning. It's really a great opportunity for me to be able to spend some time with you and your members who are so critical to the health of our community. So I appreciate this opportunity very much. I didn't actually realize that this was a sort of video presentation, so I'm not going to be able to share any, I don't think, be able to share any graphics with you, although we can try that if you want to experiment a little bit, but otherwise I can just speak and give you a verbal description of where we're at and where we may be headed. There's clearly a lot in flux right now, but let me just start, I guess, with what you were asking about phase 2, which we moved to almost 2 weeks ago, after having a very nice response to our stay-at-home order. Our cases and our metrics for COVID activity, which includes cases per 100,000 residents, the trend in transmission dynamics with respect to how many people each case transmits COVID-19 to, our hospital status, which is been decreasing since April and remains very stable and in good shape right now with plenty of capacity, and our testing capacity, which has been increasing progressively, and in the last 2 weeks, two full weeks of the calendar has actually doubled over what it had been previously. So we're now doing more tests than ever. Having met the state's, metrics, which in general look at the big picture, there's not any one measure that is a make or break other than perhaps the healthcare system status. We would never move forward if our healthcare system was not able to adequately treat COVID-19 patients and other patients that needed emergency care. We are now experiencing, to my disappointment, a rather brisk rise in cases in King County. And this is comparable to what you're hearing around the country as communities start to reopen. Now, we had started from a better place than many other communities, and I was optimistic that our community would be able to follow the guidance that we had been trying to communicate at every opportunity about the need to continue to take precautions with respect to distancing, mask use, and avoiding large gatherings without mask use in particular, to the greatest extent possible. But the brisk rise in cases tells me that folks aren't really complying with that to the extent that we had hoped. And so one of the things that I would like to get your help with today is reaching out through your channels to every business, as well as any other community-based connections that you might have to help us reinforce to our King County communities, both businesses, organizations, and individuals, that there is apparently a misperception that because we've moved into phase 2, somehow the risk of COVID-19 is lower, and that we don't need to take the precautions that we had been previously taking during the stay-at-home order. The fact is that the virus is and remains very prevalent in the community across the country and across the world. It will take any opportunity to infect people who give it that opportunity. It's not going away anytime soon. And there is no way that we're going to be able to move forward safely without continuing to take serious precautions. And by that, I mean, basically, we will have to transform the way we interact with one another, do business, and have any other type of social, recreational, or other engagement. So that could, run the gamut from changing the physical environment to create physical barriers and spacing out people in workplaces and other venues like churches or other houses of worship or any place where people might gather, to wearing masks whenever in public, with the exception of being outdoors when distancing is possible, to continuing to avoid gathering with large numbers of people, and to the extent possible, folks should have as few interactions as they can. And need to in order to go about their business. So let me give you a little more information on what's happened recently. All right, so over the past 7 days, compared to the previous 7 days, the number of cases has risen by over 150, or at least 40% greater over this week over last week. And last week was a bit of an increase as well. So we're seeing a bit of a jump. And last week's case count was 416, which was the highest that we'd seen since early May. And this week's is likely to surpass that. Yesterday was the highest single number of cases that we've had in many weeks. The trends in who's getting infected are changing. Initially, the outbreak was primarily involving residents of long-term care facilities and older adults. But right now, the majority of cases are people under 40 years of age, and in particular, over the last couple of weeks, 20 to 29-year-olds, 30 to 39-year-olds have increased to the greatest extent. And that is consistent with a lot of anecdotal reports of young people crowding into retail, restaurants, and other establishments, recreation as well. So we don't have scientific studies, but we do have a lot of reports of sightings of younger people gathering together in many different environments. But I don't want to give you the impression that this is just about young people. It's just that's the group where we're seeing the biggest increase right now. So we're looking at people of all ages taking too many opportunities to be close together without exercising precautions. Our healthcare system still is very rock stable, but that can change very quickly. The number of hospitalizations and deaths have not increased. The number of visits to emergency departments has not started to increase yet, although that may happen. And much of this is due to the fact that younger people have less severe illness, and also it takes a while after someone becomes infected to be sick enough to seek healthcare. So we may start to see a strain on our healthcare system over the coming weeks. And when we start to see that, then we have to think extremely seriously about taking steps to reduce transmission in the community, which would mean going backwards towards phase 1 instead of forwards towards phase 3. So for all of these reasons, I'm hoping that both the members of the chamber, as well as every other civic organization in our community, can understand the gravity of this situation and reach out to their members in any way possible to have them understand that the risk has not gone away, that the risk will be with us for months, if not years, although I'm optimistic that the risk will decrease over time after enough people become infected or a vaccine becomes available. But at this point, the risk remains as it was when this disease first emerged, and that we need to take steps as a community so that we can continue to move forward safely without overwhelming our healthcare system and leading to unnecessary and preventable hospitalizations and deaths. So what that means for perhaps your community might mean getting out in your neighborhoods and looking at how businesses are operating and helping us bring those that are not adhering to the governor's requirements for safe COVID-19 operations that are required to be open at this point, to get them to be more compliant. And that could mean mask use in the facility, occupancy levels, and so on, screening healthcare workers. But I know from my own experience, walking around my neighborhood, riding my bicycle in and out to work, that there are plenty of businesses that are not adhering to the mask guidelines. And I wouldn't be surprised if there are people gathering in close proximity as well. So I'd like to have time for the members to ask questions about what's useful and most greatest interest to your group. So I'm going to stop here and make sure that we have plenty of time for what's most useful for you.
Great. Well, I have a couple questions. So, looking at the key indicators that the county has put together on the website, what is the blue dot? So when we're looking at the healthcare system readiness, the beds occupied by hospitals, that's blue instead of red or green. Is that the mid, not meeting the target, but it's not under the target? What is that?
I think it's a mistake. It's probably should be green. I don't know why there's a blue dot there. All right, let me see. Oh, let me go to the actual live website for a second, take a peek. That's the first time I've seen a blue one.
Me too. I check it very often, so I love having it available. But I was curious what that was.
Yeah, I think that's probably a mistake. I'll check with our epidemiologist.
So what does the county's contact tracing program data show as activities or locations that might be contributing to the increase in cases? Has there been any knowledge around that at this point?
Mm-hmm. Yeah, this is a really tricky thing. So the disease, has a 14-day incubation period, which means that if we become aware of a case, that case could have been infected, anywhere in the activities that they did, in the 14 days before becoming ill. So it's quite a lot of things that people do in a 14-day period for us to ask about. And it's not possible to identify every activity that someone has done, every venue that they've been in, business, restaurant, coffee shop, a house of worship, recreational activity, workplace, etc. So teasing that out for a very common disease, right, is really not possible in most cases. This is, think of influenza, for example, during the winter time, you know, when so many people have influenza and it's so widespread and you develop influenza and we want to figure out where you picked it up. It could have been anywhere you've been, you know, in the last week or so, or for flu a little bit less, actually, last 48, 72 hours. But you're in an awful lot of places. So what we do is we look for clusters, and that's really our main way that we identify transmission venues, when we see groups of people who are associated with a single event or a single site. The most common way that we believe, or I should say the most commonly recognized risk factor, is household transmission. About a third, 20 plus to a third of our cases are reporting that there's been another household member with COVID-19. Now that doesn't tell us where that person in the community acquired it. The other commonly reported associations are working in or residing in a long-term care facility, being an essential worker, are the top. Short of that, we presume that, and many of these cases as well, were acquired during one of their many exposures in the community during a fairly long exposure period. So we don't have, you know, like smoking guns that can tell us, you know, there's one particular sector or one particular activity that seems to be standing out as a driver of transmission currently. We believe that there are so many people who are infected right now and so many opportunities for transmission that it's occurring in so many different places that we can't pin it down. Now you can contrast this to a rare disease, you know, a more rare disease like hepatitis A, for example, where there are so few cases in the community that are happening acutely that when we hear about a cluster, we can commonly, you know, with a relatively small number of people, look at everywhere they've been and look for commonalities. And it's not uncommon that we can identify likely sources of transmission. But when a disease is extremely common, and in particular when its exposure period is quite long, that's very hard to do. We are also becoming increasingly aware of workplace clusters in general, which shouldn't surprise anyone, because as people go back to work, you know, and people have lots of opportunities to acquire COVID, and they spend a lot of time in the workplace. The workplace can be an environment where people both acquire and transmit the infection. So we are trying to build a team that can respond to the growing number of cases that we're hearing about in people who are employed in various workplaces, so we can identify and respond to those more quickly. But there is not one particular sector like we could point to perhaps in Yakima or some of the Eastern Washington locations where they've had very large outbreaks, in particular food processing plants, for example. We haven't seen that yet, and I hope we don't. So it's, for us, it's a mixture, I think, of very widespread community transmission happening in multiple different venues.
So what is the current thinking on transmission by touching objects? You know, and you know, can you talk a little bit about that and how long, you know, an untreated surface becomes safe?
Yeah, by far and away, the main way people acquire this disease is through the air, through droplets of various size that get expelled when people talk, cough, sneeze, sing, speak, shout. Most of the droplets are rather what we call larger size that don't stay suspended in the air very long and fall to the ground and typically don't travel, you know, farther than 6 to 12 feet. But there is a small contribution from finer droplets that can remain suspended in the air for longer periods. And that's why for people who are in poorly ventilated environments or have prolonged contact, the risk is higher. And that's why face masks are recommended globally now, because of the ability to reduce that risk from droplets that come out from the mouth and nose. It doesn't eliminate the risk, but it reduces it. Nothing other than physical separation can eliminate the risk. Acquiring the virus from contaminated surfaces is possible, but it's not thought to be a very important contributor to the overall burden of cases. The virus lives for relatively short periods of time on surfaces, and it depends on the type of the surface, whether it's, sort of paper, cardboard, porous or not porous, smooth or not smooth, whether it's exposed to sunlight or not exposed to sunlight or the environment. Shiny, hard surfaces like metal and hard plastic, the virus will survive longer, maybe in the range of a day or two, many hours, or as opposed to just a matter of minutes to hours on some other surfaces. And for that reason, hand washing remains important and cleaning surfaces remains important. But I wouldn't obsess over that route of transmission. And the virus, after a few days, would no longer be viable on surfaces, even if there wasn't anything special done to try and remove it. So the focus for preventing transmission in workplaces and other environments should be on mask use, preventing close contact, minimizing the duration of contact, and increasing ventilation. And for those of you who are interested, there's increasing research and publications looking at the potential utility of ultraviolet types of various types of ultraviolet light to inactivate COVID-19. And there is a lot of good data on the importance of increasing ventilation to the extent possible by bringing in as much outside air. This has to be done in consultation with HVAC experts typically, but opening the windows is the poor man's way to achieve that.
Could you talk a little bit, there was some publicity around the dexamethasone, would love your thoughts on how that might impact things or not.
Mm-hmm. Yeah, dexamethasone is a type of medication, a steroid medication that has been shown in a couple of reports to improve outcomes in patients who are seriously ill with COVID, predominantly patients who are receiving mechanical ventilation in hospitals. There's recent data, so that's great news, for a certain subset of patients, and there are other medications that are also being evaluated for that purpose. It's not a preventive treatment. It's got major side effects, so shouldn't be taken unless the benefits clearly outweigh the cost with respect to those side effects. And there's recent data that suggests that in patients who have less severe illness, it can actually make the disease worse. So the jury's still out on exactly how it should be used best, but I think this is one of the promising things about being able to minimize the damage that this disease does in our community for as long as possible, because over time more treatments will become available and be able to be accessed. Dexamethasone, because of those recent publications, now all of a sudden, to no one's surprise, is in short supply. So everybody's gobbling it up, wants it in their hospital to try and use on their critically ill patients. Similar to what happened with the hype around hydroxychloroquine, which turned out not to be useful, but it disappeared, off of the pharmacy shelves very quickly because people will just grab anything that they think might help. That's a story with dexamethasone. It seems to be useful in severely ill patients, but not in less severely ill patients. And it's not a treatment that doesn't have significant side effects that need to be considered before it's used.
So, we're about 3 weeks out from the widespread social justice protests and rallies across our communities that were, large and small. Is there any data to show that the rise in cases and transmissions is related to these, or, you know, are you seeing clusters in other places?
Yeah, so we were very interested in this question because it was not clear, the extent to which these large outdoor gatherings would facilitate transmission or spark outbreaks. And around the country where health departments have looked, including here, we haven't found evidence to link those protests to spikes in transmission that are being seen throughout the community. There probably was transmission that occurs, anytime you bring 60,000 or 100,000 people together. And I'm sure that there were cases that were acquired in those venues and they have been spread. But as far as we can tell, in a period, in a relevant time period that encompasses, the time you would expect cases to occur after those large gatherings until recently, when we saw a total of 1,000 cases reported here in the county, only about 30 or so were reporting any link to those protests. So relatively small number of people. And of those, about 40% had another significant explanation for how they might have acquired COVID. So it wasn't as though, they were staying at home and went to the protest and didn't do other things that could have exposed them to COVID, such as, reporting a household member with COVID or a coworker with COVID or contact with someone else who had COVID. So, I think that anytime you bring large numbers of people together, there's likely to be transmission, but we don't have any evidence that those protests are contributing more than the other venues in which people are gathering together in our community because of reopening, so in, the context of restaurants, retail, and recreational activities and so on. Unfortunately, because there are so many different ways that people can become exposed to COVID, it's hard to sort out, with great certainty. If we didn't have COVID transmitting anywhere else, and we, then we could say, well, the protesters, if they develop COVID, probably acquired it at the protest. But because we know that a protester also may be employed and or may shop or do something else in the community where they come in contact with others, it's very hard to attribute, the infection to a specific cause. But it's reassuring that the overall number of cases that were being reported among people who say they've been at one of those protests is relatively low. And the city of Seattle sponsored 2 free testing sites that were widely advertised, and they've tested many thousands of people and have come up with a very, very low positivity rate. And we believe that many protesters took advantage of that testing venue. So that didn't show, an alarming rate of positive cases either. So, the bottom line is neither in King County or anywhere else across the country where people have looked have we been able to link those protests to spikes in community transmission. And
that's
I
really
think that
good to hear. That's kind of, it is encouraging.
yeah, it's somewhat encouraging. I mean, I think that it's a good testimony to how safe outdoors is with respect to indoors. If those had been indoors, we would have undoubtedly seen large-scale transmission.
Right.
It's all about the environment diluting the breath, the air, and the wind, just blows things away and disintegrates those little clusters of viruses. But it's still. I'm sure there were cases transmitted among people who had close face-to-face contact, or with the tear gas and smoke, people coughing a lot. There must have been opportunities for transmission that occurred there, but relatively few compared to the size of the gatherings.
Right. Could you talk a little bit about the safety from your perspective of travel and of some of the nursing facilities and assisted living facilities? Are we at a spot where it is safe for people to be moving about as needed, or starting to live in a nursing facility?
Yeah. So when you say travel, do you mean travel from a nursing facility to
Um,
somewhere
Air
else?
travel.
Oh, air travel.
Yeah.
Well, so anytime you go out in public, there's risk, right?
Hmm.
There's going to be risk in everything we do. So um, the risk will increase with more interactions with other people. The risk will increase with prolonged interactions in closed environments where there's less airflow, and the risk will increase with according to whether face coverings are used or not. So with travel, the more people you come in contact with, the more closed environments, and to some extent the touched surfaces, frequently touched surfaces, all increase the risk of COVID-19. The other, of course, the other risk is your destination and what the community is experiencing there with respect to COVID transmission. So, anytime you leave the home, you're having some risk for COVID. So travel is clearly, it depends. Are you traveling by car? You're staying in hotels? Are you traveling by air? How many different venues will you be in? How many people will you be in contact? All of those, will affect your risk. But the bottom line is, the easy way to sort of calculate your risk is more people, closed or close environments, longer duration of contact, more touch surfaces, make the risk higher. So travel clearly is a risky thing, but risk is relative. So it depends, what type of travel and how important that is to you.
So kind of in the same vein, let's talk a little bit about buses. Can you speak to the future plans regarding public transportation to reduce infection rates there?
Yeah, I'll take that and then I'll go back to the long-term care facilities.
Okay.
I cannot comment on public transportation. I'm not sure what Metro is doing. I know they're taking a number of steps to decrease the risk to their ridership, but I can't speak authoritatively on that, so I'll have to defer. With respect to long-term care facilities, which you asked about. So yes, this is where the outbreak started locally, and those facilities remain extremely vulnerable to the introduction of the virus. But we do have, thankfully, more testing capacity now, so infections can be recognized sooner. We're hoping that long-term care facilities will be able to ultimately test their staff and residents on some ongoing basis so they can identify cases, before there's been much spread to others, or ideally before there's been any spread to others. But, anytime anyone from the outside comes into one of those facilities, or a resident, leaves the facility for any reason and returns, there's a risk of introducing COVID. And, right now in our community, the risk is relatively low compared to what it was back in April, when we were seeing very high levels of transmission, and particularly among the residents of long-term care facilities. But the risk is still present, and I'm very concerned that this fall, we're going to see a significant increase in transmission, both due to the change in weather, which drives more people indoors into closed environments and prevents more opportunities for transmission, but also because influenza will return, and influenza also causes people to cough and sneeze and expel lots of viral particles into the air, and is a disease which can look very much like COVID in its early stages. So things are going to get very, very complicated, and that's why I feel like we need to do the best job we can possibly do now to suppress the virus's transmission and to get people to understand and adopt long-term behavior change that will lead to lowering the risk both today and as we go forward, because the prospect for a very scary large outbreak in the fall is very real. And this is our time now, when we're at a relatively low level of transmission, to get our act together and make sure that everybody knows what they need to do. to prevent that type of scenario, or I shouldn't say prevent because that's not possible, but to minimize our risk in that type of scenario. So things like continuing to allow teleworking, telecommuting, make sure the workplace has all the physical and environmental steps and measures taken to decrease transmission, minimize risk, policies in the workplace, and that people actually comply with the requirements and the mask usage, and just get this ingrained now as a habit before the risk starts to get dangerously high.
So as we look at what has happened with other states and the current trend in our state, do you have a pulse on if King County is still hopeful that we will go to phase 3, or are we still at least 3 to 4 weeks out given the current trends?
Hopeful, yes, but this disease in this situation is highly unpredictable. It all depends on human behavior, right? Mm-hmm. So right now we're going in the wrong direction, and how far we go in that wrong direction will determine where we go next, whether we go backwards or whether we go forwards. And so I'm, it's just, although I would love to be able to say I have the power to do this, the public health department cannot determine the fate of King County. This needs to be an all of community effort. We can do interviews, we can post blogs, we can write guidance, but unless what we're saying is adopted by every sector of the community and really permeates every business, every retail, every recreational or other organization that brings people together and they understand and take this very seriously today, I fear that we're going to go too far in the wrong direction and have to take a step backwards, which I don't want to see happen. But if we are able to mobilize very rapidly and get the information out and help one another do the right thing with respect to behavior change and risk reduction, I think we can bring this curve down again and then safely move forward. But it all depends on, the health, not the health, the behaviors of our leaders and our community members.
Sorry, I muted myself. Always, wonderful parts about technology. So why, talk to us a little bit about why you're predicting a higher outbreak in the fall. Is it people going back to work or school or other reasons?
Yeah, a combination of things. A lot of things will be coming together in the fall. Currently, we're seeing increased levels of activity, and if we are successful in sort of managing our behavior, we'll be able to continue to see increased levels of activity, and that may be either increased levels of economic activity if we can move forward with the phases, but there'll also be, as you suggest, some more activity around education at some level. And it's not been determined yet, how many schools are going to open and which schools are going to open, but clearly some are planning to. So that will be one thing, bringing people together. But there's also the weather. Right now, this is the best possible environmental condition to allow us to get or decrease transmission. The sunny weather, the warm weather brings people outdoors, which is a lower risk place to spend time. It also allows us to open our windows, which allows better ventilated air spaces. And we're relatively healthy from the respect of free from other viral diseases that make us cough and sneeze and spread our infections to one another. In the fall, the weather gets cooler, brings more people indoors, decreases ventilation, and the number of other respiratory viruses that are circulating will increase, which will drive more people who might have COVID in their noses and throats to share that with others through coughing and sneezing. And just looking historically at influenza pandemics, which have occurred, over the past couple of 100 years when new strains of influenza have emerged, they're not one-time events. There's usually an initial wave, and then a lull for a couple of months, and then a larger second wave of infections. It's not possible to be certain that the COVID outbreak will follow the pattern of previous influenza pandemics, but many scientists believe it may. And those pandemics, continue to cause increased morbidity, mortality for years after they emerge. So that it's not, again, a one-time or relatively time-limited event, that the need for long-term strategies to deal with this challenge, and the need for long-term behavior change, environmental change, and the way we interact with one another is absolute. There's no way around that.
So we have a question, somebody interested in your opinion on sending a child to preschool under the current conditions.
Couple things. One is that children have less severe infection than adults. They're less likely to develop symptoms at all. When they develop symptoms, they're less likely to develop serious illness. But it can cause serious illness, so it's not risk-free, but the relative risk is much, much lower for children, young children, and people under the age of 18. The child can, in the environment with others, obviously have opportunities to become infected and then take that infection back into the household. So that's a consideration. But of course, there are reasons why children go to childcare. Parents need to work. Parents either have essential responsibilities in the community or in their workplace, or have no other option for caring for their child. So there's value. And like every other decision that has to be made in the context of this outbreak, there's risk and benefit. So for an individual family, the need to have a child in a group environment like that would be weighed against the risks to that child and the others in the household. And in both the child care setting and in the household setting, steps can be taken to reduce the risk of COVID being transmitted to others. So child cares, can break or should be breaking classrooms into small groups, having dedicated teachers, trying to the extent possible with young children, sort of minimize the risk for close contact, which isn't always, that much. You can't really do that very effectively sometimes with kids. But if you have a decreased number of children, that reduces the risk. And then there's, steps around the environment, ventilation, cleaning. Younger children can't wear face coverings, but the staff can. And then in the home, trying to limit interactions of the child with adults who might be especially vulnerable. So, older adults and grandparents, and minimize the types of interactions they have. There's guidance for these types of things increasingly on the CDC website that talk about how to reduce risk in various settings, childcare, household, and so on.
So along what you were talking about with kids, has there been any consideration of allowing children to meet in larger groups than adults in any of the phases?
Yeah, in school settings, for sure. Yeah. Mm-hmm.
So switching gears a little bit to when an employee, family member tests positive, and you might not know the full answer to this, but just interested in kind of the contact tracing element of things. So if employee is supposed to stay home for 14 days because a spouse tests positive or a family member, as employers, what can we do to help the contact tracing and to also help notify other staff that might have been exposed? And, do you have any insights as to how privacy and such kind of goes into what employers can do?
Mm-hmm. Yes, there's an important role for employers. Employers can do quite a bit. There's guidance on the Washington State Department of Health website, and there's currently a work group meeting, a state level work group to produce more clear guidance for employers around sort of workplace investigations and case and contact tracing in the workplace. At this point, I think I would just follow the recommendations in the governor's Safe Start plan and from the Washington State Department of Health. There's also excellent guidance on the CDC website of for a number of the issues that you've raised. Depending on the type of setting, employers can do various things. I mean, there's support for the employee to who's been exposed, to help them be tested, or to provide them with the ability to safely isolate and quarantine, while they're away from work, to communicate with public health. We certainly aim to notify employers when we become aware of employees who have COVID-19. If it depends on that the employee, the person tells us where they work and who their employer is. And sometimes there's some reluctance because employers don't want to feel that there'll be repercussions for naming the employer or for revealing that there's been other ills in the workplace. And that's one of the things we're grappling through right now is some reluctance for people that we're sensing in cooperation. That's problematic. But I think educating workers is a huge benefit about COVID-19 risk reduction, both in the workplace and in the community. The mask use and the ventilation measures are really important. And there's a group called Challenge Seattle that Governor Gregoire works with that is producing their own guidance for the business community that I'm sure she would be willing to share with your group. And she's been getting input from public health on that document. And once the state working group has come out with their recommendations, we'll provide those to you and to the governor's group, Challenge Seattle group, so that they can make any necessary revisions in the guidance that they've come up with.
Great. In regards to possible resurgence in the fall, would this mean that, there might not be conventions of any size through 2020 and possibly beyond?
Yeah, that's possible. I mean, the biggest risk is large indoor gatherings.
Right.
Groups of people, large groups of people coming together indoors is absolutely the highest risk scenario, especially when they're, having sustained contact with one another, not brief contact. So depending on, this is not an official, opinion or official guideline here, because we haven't come to the point where we need to make a policy statement on this, predicting for the future. But I think it's very unlikely that large gatherings like that, conventions and so on, will be safe for the next year. I hope I would love to be wrong about that, but I don't see any way around it unless a vaccine becomes a miraculously effective and widely available vaccine becomes available in the short term, which is highly unlikely. Right.
Thank you so much for your time and all the information that you shared with us and your insights. As a follow-up, I was hoping that you could send the link for the employer guidance you were talking about for contact tracing to the team, and we will distribute that out to participants in our follow-up email. I think that would be a great resource. And, again, please let us know how we can continue to be supportive of, getting the word out of, what best practices are and how employers can help continue to be a solution in the midst of COVID.
Well, this has been really great to spend time with you. A couple of questions or comments at the end. So I'll send you the links for businesses, but the contact tracing is you have to request through contact, right at this point, Challenge Seattle.
Okay.
And then once we have a document, because we don't, we're still meeting as a work group, be happy to share that, but there's nothing to share at the moment around contact tracing, but there's lots to share just around business guidance, which I'll be happy to. Can I just ask you, from your perspective, can the Chamber of Commerce Are you willing to commit to actually getting out there and working with your members and, going door to door to make sure people know what they're doing and they're complying and that they're taking the appropriate risk reduction steps? Can we rely on you to, as a community, to work with your stakeholders to make sure that we're successful and we can go forward towards stage 3, or we have to move backwards towards stage 1 with less economic activity?
Yeah, the chamber is definitely committed to being part of that solution. We've been working really closely with Rachel Smith and Callie Knight and folks to get masks to people, to educate, and we're actually going to be doing another really big push in the next week to really help people, one, understand why they need to be wearing masks, and then getting them those supplies so that they can make sure all of their employees and, a dependent in the house also has a face covering and can be using that, and disposables for customers that might not come in with them. So to really, help equip people, I think that's the area that we're really looking forward to being able to lean into with some tangible solutions for business owners. Of here are the posters. They're available in 9 languages from King County that, to help explain what type of masks, how to wear a mask. My own personal commentary, it's physically painful for me to see people wear their mask under their nose. So,
yes.
I've gone out for a walk or around, gone to pick up something at the grocery store, and it's like, I love that you're wearing a mask. Let's cover your nose too, and this is why. So, I think we will continue to be a partner in that, and we'll work with King County in any way that we can be helpful.
Yeah, I really appreciate that. What do you think about the idea or the feasibility of just, getting people out in the neighborhoods, walking around in the businesses, and just, talking with people, where they see problems, and trying to educate and help them do better? I can just tell you, I can walk in any neighborhood right now and find lots of issues.
Yeah,
but I'd
likewise.
Yeah.
Yeah, no, I think that's definitely something we could take back and see how we might be able to deploy, or even have different thought leaders around, in certain areas, or work with the various networks of chambers that they could go to their local businesses and
Yes,
answer
exactly.
questions and stuff. So, maybe that's a great program we could work on with the county, to, one, equip the people that might be talking with folks, right? Because I think that's one thing we want to make sure, that there is proper information being given out, not opinion, and really helping equip businesses. We're all in this together. We've heard that a lot, but we're all in the same, we don't quite all know how to navigate this, and are all learning together as well. So, something like that, I think, could be a great way to help businesses and to equip them as well.
I agree. And I just want to leave you with this last thought, that we don't have a lot of time. So this has to move pretty quickly, or the virus will get ahead of us. And we will be, in some ways, we're going to reach a point of no return with phase 3. So we're really, at least for now, if we don't do the right thing as quickly as possible. So I'll work with Rachel to try and get you whatever support that you would need to get on the ground and out there and talking to, the community in the various neighborhoods, so that we can give it our best shot.
Yeah, and what's, I think, a really easy first step is, as we're distributing face coverings and masks in the next week, we'll have the opportunity to be talking with people as they're doing their pickups. Obviously we will keep our distance and be wearing masks as well, but making sure that we can include resources and education as part of that. So thank you so very much for your time. I always learn something when I speak with the experts on this, and even more so talking with you, Dr. Duchin. So thank you very much. And I hope everyone has a wonderful rest of their day. It looks so beautiful outside. So an opportunity to get a little fresh air on your porch or your balcony, or open your windows.
Thank you. Bye-bye.
Thank you. Take care. Bye-bye.